Initially, my practice was very much Botox and fillers and lasers and so forth as far as aesthetics. But what you will find with body contouring, which is huge, is that you will see your practice do a dramatic shift. With body contouring, at least half your patients will be male. And these are men that never really thought about doing anything, and you don't really even have to promote that much outside your office. Them coming in just in your office, seeing a loop or having brochures out there, they will ask about fat. They may be embarrassed to talk about it, but when they see the before and afters, they're gonna ask you about it in the room. They may be in here for a skin check, or they're worried about a mole or skin cancer, but when they see these before and afters, they're gonna ask you, well, what about that? Or what about that I saw in your waiting room? And so you're gonna find that you're gonna have a huge percentage of the male populations that you never captured before aesthetically, now part of your patient population as far as like body contouring. Vanquish just came out with what they call maximum energy. And what that is a hardware and software upgrade that they just came out with that is going to make the machines even better. So what that does is that it increases the conductivity of the heat to the fat impedance. So it's going to make the machine more effective for the patient, more comfortable, and more impressive results, and more dramatic than what we've been getting. We've been getting dramatic results, but can you imagine even more dramatic than what we already have? Over the 2 years that we've been doing Vanquish, and now I currently have 2 machines because it's been so successful, we have not had any adverse events. So it's a very safe machine, and patients are really happy with it. I think body contouring in a non-invasive way has so many advantages beyond the fact that it's non-invasive. Non-invasive is great. There's no downtime for the patient. There's no OR costs. There's no recovery. But the really big side of it is, if you look farther into it psychologically, is that you're giving these patients the ability to feel good about themselves and keep themselves in those 4 size 6 jeans, right? So that is really what makes patients feel good about themselves, especially after they've been through something traumatic, like let's say, a divorce, or let's say they have a cancer, and you're able to give them the body that they wanted, and then they're able to maintain that. That, for me, is very gratifying as a physician.